everyone. People are trickling in. He's over here. Yes. Welcome to our TANF Program Integrity Office Hours, session 3. I'll probably say that a couple more times, knowing that we're still 1 minute from the actual start time. But while you are joining, we would love to know who's in the room. If you've been here before, you know the drill. It's also on the slide. If you want to enter your name, your state, and your title in the chat. There we go. Thank you, Angie. Who's going to kick us off from South Dakota? Hi, Elizabeth. So as people are coming in, I'll give some quick logistics. We are going to record the first part of today's session. The recording and the companion resource for this session will be posted to the STAR website after the session. Not immediately after, we'll tell you when it's ready, but we'll be sending a follow-up email with links and resources as well. So here's how the next hour is going to go. We will spend the first part grounding ourselves in what strong TANF spending oversight for subrecipients can look like. So the building blocks, I'll be walking through that portion, and it's the only part of the session that's going to be recorded. So I'll then prompt our team to stop the recording, and I will pass it off to our state learning partner who's joined us to share their experience, and then we'll open it up for some Q&A and peer exchange. And then just a note on the format, we really want this to feel more like a practitioner conversation than a webinar. So there's a chat open throughout. Use it to react, ask questions, flag things that you want to come back to when we get to the discussion portion. Next slide. Great. Thanks all for introducing yourselves in the chat. I will kick off quick intros on our end. So I'm Sam Vance. I'm from Mathematica and the State and Tribal Technical Assistance and Resources, or STAR, project team, which supports OFA's TANF technical assistance initiatives. Specifically, I lead our program integrity work, helping agencies track and understand their non-assisted spending to hopefully help you all feel more supported in making better decisions for the families that you serve. And we want to thank our partners at OFA for making time to welcome all of you. So Janelle, I will hand it to you.
Hello all. Thanks, Sam. I'm Janelle Jones from the Office of Family Assistance. I'm part of the TANF Technical Assistance and Special Initiatives TASI team, as Sam mentioned. We oversee the STAR project. It's great to see so many of you all joining us today. As many of you know, recent GAO reports have highlighted the importance of strong oversight of TANF funding activities, particularly when services are delivered through contractors and subrecipients. Those reports also reinforce something we've been hearing directly from states, that opportunities to learn from one another are among the most valuable forms of technical assistance. This webinar series is a direct response to that need. It's designed to give agencies the opportunity to hear from their peers, share practical approaches, and learn about strategies that are working in the field in a collaborative, practitioner-focused setting. Program integrity remains a priority for OFA, and we're committed to supporting states as they strengthen their oversight and monitoring practices. We're grateful you've joined us today, and we hope you leave with ideas and tools you can apply in your own programs. With that, I'll give you all an overview of why this matters, and then I'll turn it over to Sam. There's a lot on the plate of TANF agencies right now, and many of today's challenges come back to two responsibilities: making sure federal dollars are used appropriately after they're awarded, and being able to demonstrate effective oversight. This slide explains why we're focusing on subrecipient monitoring today. Starting on the left, GAO's December 2024 report found that while states report TANF expenditures by categories, those reports often don't include enough detail about subrecipients or how non-assistant funds are being used. When reporting lack details, it becomes harder for both states and HHS to understand where funds are going and identify potential issues early. Right now, Emily's gonna drop a link to that GAO report in the chat. In the middle, GAO's 2025 fraud risk report found that HHS doesn't have standardized procedures for conducting regular fraud risk assessments and doesn't consistently involve state and local partners in that process. While that finding is directed at the federal level, it also highlights the importance of strong oversight at the state level. Risk-based monitoring of subrecipients is one of the most effective tools agencies have to identify potential issues before they become a more larger compliance problem. And there's another link to that GAO being dropped in the chat, or GAO report. The third box ties those findings to your day-to-day responsibilities. 2 CFR 200.332 requires pass-through entities, which includes TANF state agencies, to assess their risk of each subrecipient and tailor monitoring based on that risk. What that means in practice is straightforward. When your agency provides TANF funding to a workforce organization, a child care provider, or another service provider, you're delegating service delivery, not accountability. The state remains responsible for ensuring those federal funds are used in accordance with federal requirements. That's why subrecipient monitoring isn't optional, it's a requirement. The regulation requires agencies to assess each subrecipient's level of risk and tailor monitoring activities accordingly. Factors such as prior experience managing federal awards, audit history, staff turnover, and significant changes to financial or management systems should all inform that assessment, sorry. So the common thread across all three of these boxes is risk-based monitoring. It improves financial transparency, strengthens fraud risk management, and helps states meet their federal oversight responsibilities. That's the why. Now let's turn it to the how, what effective risk-based subrecipient monitoring looks like in that practice. So I'll turn it over to Sam to explain more. Thank you all.
Thanks, Janelle. Perfect. So yes, and before we get into the how, it helps to know what you're actually assessing. So across the field, whether you look at the Association of Government Accountants Risk Assessment Monitoring Tools, state comptroller checklists, or any of the GAO guidance, it's really the same 5 categories that come up again and again. So when thinking about the factors in the subrecipients. So that's what we're talking about when I go through these. So financial stability. Is the organization financially sound? Cash flow, audit results, whether spending tracks with the budget. Legal and compliance standing. Are they in good standing? Is there a history of lawsuits? What's their current status on sam.gov? For things like debarment. For those that don't know, debarment is a formal federal action that bars an organization or individual from receiving federal contracts, grants, or assistance, usually because of prior fraud or criminal conviction or serious compliance failures. So before a state awards TANF funds to a provider, federal rules require checking whether or not that organization is debarred or suspended. And SAM.gov, the system for award management, is that official database where those exclusions are listed. It's essentially the do not fund list. So checking there before executing a contract is a required step, which most of you probably know and are very familiar with. So then the audit and monitoring history. What did, if there was a last review, if we've worked with this provider before, what did that last review find? How long ago was it? Same questions per prior site visit. And how long since that site visit? Are there any unresolved prior findings that are still lingering? What is their programmatic experience? Have they done this kind of work before? Is, specifically with federal funds? Are they familiar with these processes and protocols? And then like staff and system stability. Have there been any key personnel changes, new financial systems? Is this award being tracked separately from others? Do they have like the infrastructure to do that? None of these require a sophisticated scoring system out of the gate. It's the point is just to have a documented basis for your monitoring decisions, so they're grounded in evidence and policy and not just habit. And then we'll come back to some specific resources in a few minutes. Next slide. So you might be wondering why risk-based specifically. So in TANF, you may have dozens of subrecipients delivering services across multiple programs. And you can't review every invoice from every provider with the same level of intensity. It's not realistic or cost effective. Risk-based monitoring means that you put your heaviest scrutiny where the risk is actually highest, right? Kind of like thinking about the domains that we just talked through, a brand new provider with no federal grant history gets more oversight than when your team has worked with for 10 years with a clean track record. This approach is what the uniform guidance and program integrity frameworks recommend precisely because it lets agencies focus limited staff time and resources where they'll have the most impact. The domains tell you what to look at, and then these 4 practices on this slide describe how the system, holds together. So first, standardize the process. If each program team is monitoring differently with different templates, thresholds, documentation, you lose that consistency and comparability. Second is the tiering by risk. And you can start with a self-assessment from the subrecipient. I feel like you're going to hear me trip up on those specific words over and over again in this. But you use those responses to assign a risk tier and then match the depth of monitoring to that tier. So this is how limited staff time gets directed where it's actually needed. Third, separate and cross-check duties. This builds in that like check and balance between fiscal and program staff. So when one team reviews the other's findings before anything goes back to the provider, you can catch things that neither side might have caught alone. And then fourth is formalizing corrective action, right? There's got to be like some teeth to this thing. So every finding gets a documented next step. What will be corrected, by when, and what happens if it isn't? That closes the loop. Nebraska, our state learning partner, has built a version that, touches on all 4 of these, and they're going to walk through that exactly how. But first, I'll go through another piece of the picture, which is how the monitoring intensity actually scales with risk. Next slide. So here we capture kind of the core logic of risk-based monitoring. So not every subrecipient needs the same level of attention, and applying that uniform scrutiny to everyone creates a resource problem. You end up over-reviewing low-risk entities while potentially under-reviewing higher-risk ones. And this is actually GAO's own research on using identity verification controls for subrecipient and users, but they have a tool where you can like simulate different types of monitoring, uniform, risk-based, you can tier it, and they've done many write-ups on this, but it's that the risk-based tiers consistently outperform a uniform standard at the same cost. So at the minimal review level, and these are just examples, you have subrecipients maybe, for example, that have clean track records and really stable operations. So the oversight can look like scheduled financial report reviews and periodic check-ins. That's appropriate. Then the standard review level, they may be a completely new subrecipient for your agency or a first-time federal grantee, or they've had something significant change. Again, new staff, new system, that warrants closer review. And so that could be more frequent reporting or a desk audit. And then intensive review level, this, provider might have repeated issues, repeated audit findings, or significant findings. This would trigger your full toolkit, an on-site visit, deeper sampling, documented corrective action plan. And again, the specific tier labels here and the thresholds that you use, that's a matter of your agency's judgment. What matters is that the tiering is documented and applied consistently. Next slide. So the tiering on the previous slide isn't intended to be a one-time assignment where that's like their marker and they're like, low oversight, medium risk, forever. It's intended to be living. And so this kind of shows how it flows in sequence and how the level adjusts as you learn more. So the process of risk tiering starts before the monitoring begins, when they complete that self-assessment covering their prior audience or audits, grant experience, and their financial systems, and all those other pieces. So that information can directly inform that initial tier. From that assignment, the monitoring plan for the year is set. You've got your depth, the frequency, method of review. That's step 2. Step 3 is ongoing. The desk reviews, site visits, invoice audits, they run on the schedule that the risk tier sets. For financial monitoring, it's often quarterly. And then step 4 is what makes the system adaptive. If recurring errors are found, the risk tier automatically goes up. That triggers a corrective action plan with a clear escalation path if improvement doesn't follow. And again, our state learning partner has implemented the sequence, and we're very close to passing it off to them. Before we do, I'm going to share some tools as like a starting place that you can draw on to build something similar. Next slide. Right. We wanted to make sure that we give you something concrete. These resources are all free and they're grounded in that same regulatory framework that you're already working in. So this first one, the AGA Risk Assessment Monitoring Tool, and I said it once before, but I will try to say it again now. AGA is the Association of Government Accountants, and it was developed in partnership with OMB. So it's a scoring tool that you can adapt to your context. Several states have built their own version on top of it. They're easily accessed through public state resources, but we'll also share some examples from states shortly. So the second one, also from AGA, that subrecipient monitoring and self-assessment guide from 2017, it's a companion document that maps monitoring questions directly to specific uniform guidance citations. So if you want to build out a monitoring checklist and make sure you're covering the right CFR requirements, this is your roadmap. Uniform guidance establishes the policy requirement, and then this guide kind of helps you operationalize it. I'll pause quickly on uniform guidance, which Janelle also touched on, but just to be really clear. So officially, uniform guidance, like 2 CFR Part 200. This is the single set of federal rules that applies across all federal grant programs, including TANF. It replaced a patchwork of older circulars and is what the specific subrecipient monitoring requirements that we're referencing all session lives within. So the AGA guide is built directly on that framework. So for you, if a question comes up like, is this required or just recommended? If the AGA guide cites it, it's in the uniform guidance and it's required. So it's handy to have. The next one, the state subrecipient monitoring tools. Several states publish their own tools publicly, and they're ready to adapt. So if you don't want to start from a blank page, borrowing and modifying a state example is a totally practical shortcut. We're going to share some specific examples like Arizona and Colorado here in the chat and in the companion document that's forthcoming. And then lastly, the Holy Grail, the GAO Green Book, otherwise known as the Standards for Internal Control in the Federal Government. This is the foundational policy document. So the 5 components: control environment, risk assessment, control activities, information and communication, and monitoring. Those are the structural elements that every monitoring system builds on. And if you are building or planning to build or defending your monitoring framework to leadership or auditors, the Green Book is your policy anchor, your go-to. So Emily, if we can drop those links in the chat. And again, I'll also share these over email following the session. Perfect. So that is the background, the building blocks, and a place to start for TANF spending oversight with subrecipients. For any of our on-demand viewers, you can visit the Program Integrity Office Hours webpage on the STAR Peer TA site to view recordings from other sessions, which will also include a recorded recap of the session and key takeaways, along with the companion product that I mentioned, which features the State in Focus case study and links to the resources on this slide. So we will pause the live session recording here as we head into the more interactive portion of the agenda. Discussion among state peers who attended the live session. The state presentation and peer discussion portions of the session are not recorded. However, key themes and takeaways from each session are summarized and shared. These recaps are posted following the recorded introduction to support individuals who were unable to attend the live session or who would like to revisit the information. This recording provides a brief summary of the case study presented during the session, along with key points raised during the peer discussion. Staff from the Nebraska Department of Health and Human Services shared how they transformed their subrecipient monitoring process by developing a standardized risk-based approach that strengthens oversight, improves consistency across programs, and makes better use of existing staff resources. Nebraska's approach began with a concrete challenge. Internal audit findings revealed gaps in oversight across its 27 economic assistance programs, each of which was using its own standards and protocols for subrecipient monitoring. The approach varied from program to program, resulting in inconsistent practices and uneven quality of review. In some cases, lower risk subrecipients were receiving more intensive monitoring than those with greater compliance concerns, meaning staff effort wasn't being directed where it was most needed. This made it difficult for DHHS to ensure monitoring activities were identifying the right issues. At the same time, staff resources were limited, creating a need for a more strategic and sustainable approach. Rather than continuing with the program-specific monitoring practices, Nebraska developed a standardized monitoring approach to implement across all programs. At the core of Nebraska's approach is an initial risk assessment that determines how each provider will be monitored before the monitoring plan is set. New providers complete a self-assessment covering their prior experience with state and federal grants, audit history, and the financial systems they have in place to track and manage funding. For returning providers, the assessment draws on the prior year's performance and any findings from previous reviews. Based on those responses, each provider is assigned a risk tier that determines the intensity of oversight, including the frequency of desk reviews and site visits, and the share of invoices subjected to financial audit. Lower risk providers with a clean track record receive a lighter but consistent review. Higher risk providers receive more intensive scrutiny. And the system is designed to adjust. If errors surface during monitoring, the provider's risk tier escalates automatically, triggering closer review and a documented corrective action plan. This allows the agency to focus additional attention where it is needed most and ensure monitoring effort is distributed efficiently and effectively across all providers. Nebraska also implemented a standard cross-checking protocol between fiscal and program staff of all subrecipient reports, expenditures, and audits. Rather than the finance team reviewing expense reports and the program staff reviewing services and activities, both teams now examine all documentation independently and align any findings before communicating to providers. This cross-checking process has strengthened internal communication, improved the quality of monitoring findings, and encouraged staff across the agency to recognize potential issues that may have previously gone unnoticed. To support implementation, Nebraska developed annual monitoring plans for each provider. These plans outline monitoring activities, documentation requirements, reporting expectations, and review schedules for the entire contract year, giving both staff and providers a clear understanding of what to expect while allowing adjustments when provider risks level change. Nebraska captured this work in a standardized subrecipient monitoring manual, a step-by-step framework applicable across all 27 programs. While each program's subject matter differs, every program now follows the same core process, the same risk assessment criteria, the same review structure, the same documentation requirements, and the same escalation steps when findings arise. That consistency means staff can move across programs without relearning the monitoring process, and supervisors can evaluate work against a common standard throughout the agency. Developing the manual took approximately 18 months from planning through implementation. Staff began by reviewing federal requirements, documenting existing practice across programs, establishing a shared baseline before drafting began. Rather than producing a finished product and introducing it as a new directive, Nebraska invited input from program and finance staff across the agency throughout the process and ran drafts through procurement and multiple levels of leadership before the manual was finalized. That investment helped build agency-wide support and resulted in a stronger final product. Importantly, the manual provides structure without replacing staff judgment and professional discretion. During the peer discussion, session participants explored practical questions about implementing standardized monitoring systems across complex organizations. One discussion focused on how Nebraska adapts monitoring throughout the year. The presenter from Nebraska DHHS explained that monitoring plans are designed to evolve as new information becomes available. When fiscal or program reviews identify concerns, providers may receive corrective action plans and increase monitoring. If issues are resolved successfully, monitoring levels may return to their original status. This flexible approach allows oversight efforts to respond to changing risk rather than remaining fixed throughout the contract period. Participants also discussed how Nebraska coordinates monitoring across multiple divisions administering TANF-funded activities. Like many states, Nebraska uses Memoranda of Understanding, or MOUs, with partner agencies while maintaining centralized oversight of the TANF grant through the Office of Economic Assistance. Several attendees asked about technology supporting the monitoring process. Nebraska explained that while the agency does not currently use a dedicated provider portal, communication primarily occurs through shared email inboxes and SharePoint sites that allow providers to securely exchange documentation with agency staff. Another topic centered on lessons learned, particularly around implementation strategies for staffing and organizational structure. Nebraska described how program staff, fiscal staff, and department-level financial reviewers each contribute separate perspectives throughout the review process, creating additional separation of duties while improving overall accountability. A recurring theme throughout the discussion was that strengthening program integrity does not always require additional funding or staffing. Nebraska emphasized that their new approach was implemented by reallocating existing staff efforts rather than expanding resources. Session participants also noted the importance of investing time upfront to build organizational buy-in, recognizing that standardization and collaboration can reduce inefficiencies over time. That concludes session 3. Thank you for joining us, whether you attended the live session or are viewing this recording. The TANF Program Integrity Office Hours series was developed to support state and tribal TANF agencies through peer learning, practical resources, and targeted technical assistance. Strengthening program integrity requires not only an understanding of federal requirements, but also practical tools and proven approaches that agencies can adapt to their own operations. The date for the fourth and final session in the series is currently pending, but we intend it will focus on using data to support stronger program integrity and program management decisions. Each session has responded to priority areas related to TANF program integrity identified by GAO and ACF, and includes a recorded introduction, a state case study, and companion resources designed to support continued learning and implementation. To be added to the Program Integrity Office Hours listserv, receive updates on future sessions, or review the first 3 sessions, visit the Program Integrity Office Hours resource webpage at peerta.acf.hhs.gov/program-integrity-office-hours. The State and Tribal Technical Assistance and Resources, or STAR team, is available to support agencies through resource sharing, individualized technical assistance, and implementation support for TANF program integrity efforts. If you have questions related to subrecipient monitoring or any of the topics covered in this series, including cross-agency data partnerships, provider contracts and outcomes, and data-informed decision-making, we encourage you to reach out. You can submit a technical assistance request or send questions directly to starinfo@blhtech.com or visit the STAR website at peerta.acf.hhs.gov to explore available resources and submit a TA request through the site. Thank you again, and we look forward to seeing you for the next session of the TANF Program Integrity Office Hours series.